OET speaking dentist. Root canal. Setting dental clinic. Patient. You are a 22-year-old semi-professional basketball player. Last week, you knocked an upper left front tooth while playing basketball. Over the past couple of days, you have been experiencing tooth pain and swollen gums. The dentist has just examined you. Tasks. When asked, say you thought your tooth felt loose. You hope you won't lose it. Say you really don't want to have a root canal. There must be something else that can be done. When asked, say you're not worried about the pain or cost. You're worried about the amount of time it'll take. You don't live close by, and you have lots of training and work commitments. Your friend had the root canal and had to go to the dentist a couple of times. You hope everything can be done in one visit. Ask what you should expect after the procedure. Say you're happy to hear the tooth can be saved, even if it means that you have to come back for more appointments. You have the root canal. Agree to have an x-ray taken. Dentist. You see a 22-year-old semi-professional basketball player. He or she has tooth pain from his or her upper left lateral incisor 22. You have just examined the patient. The tooth is loose and has been moved from its original position, with swelling and inflammation of the gums indicating infection. Tasks. Give findings of examination. Infection and damage to tooth. Tooth is loose. Find out any patient concerns. Reassure patient tooth can be saved using root canal therapy, clearing of infection, repairing damage inside of tooth, removing dental pulp, filling and sealing space. Provide information on alternatives to root canal therapy, removal of tooth, replacement with implant or denture. Recommend root canal therapy as best option, most conservative option. Find out patient's reason for not wanting root canal, pain, cost. Emphasize need for 2 additional visits. X-ray taken today. Explain steps for visit 1. Nerve removed, cleaning, enlarging root canal, sealing with temporary filling. Explain steps for visit 2. Removing temporary filling, root canal filling inserted, sealed. Explain recovery process. Some discomfort, over-the-counter medication, avoiding hard foods. Establish patient's consent for X-ray. All right, Jordan, thanks for your patience. I've just finished examining your tooth. The upper left front one, right? Yeah, that's the one. I knocked it last week during a game. Took a pretty bad hit going up for a rebound. I see. From the exam, the tooth is indeed loose and it's being pushed slightly out of its original position. There is also swelling around the gums, which tells me there is likely an infection setting in. Yeah, I was worried about that. I thought the tooth felt loose. I really hope I don't lose it. It's right at the front. Would be awful for my smile. I totally understand, and the good news is you won't lose the tooth. We can save it, but it's going to require a root canal treatment. That's the best option in this case to deal with infection and stabilize the tooth. Hmm, I was hoping to avoid that. Is there anything else that can be done? I really don't want a root canal. I hear you. Let me explain a bit so you know what we are dealing with. The root canal would involve cleaning out the infected pulp inside the tooth, disinfecting the area, and then sealing it up. It's the most conservative option. It lets you keep your natural tooth, which is always what we aim for. What happens if I don't get the root canal? Well, without it, the infection will likely get worse. The alternative would be to remove the tooth entirely and look at options like a dental implant or a denture. But that's more invasive, more expensive long term, and definitely not ideal at your age, especially for someone who plays a contact sport like basketball. I see. The thing is, I'm not really worried about paying or even the cost. What does worry me is how much time it's going to take. I don't live nearby and I've got training, work, my schedule is packed. My friend had the root canal and said he had to go back multiple times. I was really hoping this could be sorted in just one visit. I understand completely. Time is a major concern, especially for athletes with demanding schedules. Unfortunately, because of the damage and the infection, the treatment will require two more appointments after today. The first visit will be where we remove the damaged nerve tissue and clean out the canal. We'll then place a temporary filling to protect it. Okay, and the second visit? On the second visit, usually a week or so later, we remove the temporary filling and seal the tooth permanently with the root canal filling. That stabilizes the tooth long term and prevents any further infection. Alright, so not just one visit, but I guess if it means I can save the tooth, it's worth it. What should I expect after the treatment? Good question. After the first visit, you might feel a bit of discomfort. It's normal. Most people manage it just fine with over the counter painkillers like ibuprofen. You want to avoid chewing anything hard on that side of your mouth until you're completely done. Once the final filling is in, you'll be back to normal function and a confident smile. Okay, I'm happy to hear the tooth can be saved. Even if I have to come back a couple more times, let's do it. I'll have the root canal. That's a great decision. First step now is to take an x-ray. That will help us get a clearer picture of the extent of the damage and the shape of the canals. Sure, go ahead and take it. Perfect. I'll have the nurse bring in the x-ray machine and we'll get started. You're doing the right thing, Jordan. We'll get you back on court and smiling in no time. Thanks, Doc. I appreciate that. Thanks for watching today's video. Remember to subscribe to our YouTube channel. Share this video with everyone you know. Have a great day and I'll see you next time.